is Missy. I'm going to be your nurse today.
Okay.
What's your name?
I'm Nairi.
You're Nairi. It's nice to meet you, Nairi.
Nice to meet you, Missy.
And this is Quinn?
Yes, baby Quinn.
Right. So he is 2 months old. Can you tell me his birthday?
March 5th.
March 5th. And what are we seeing you guys for today?
Well, I'm not totally sure. He's been really fussy, hasn't been eating very well, and I just don't know. He's not acting like he should. So I'm just not really sure. He's just probably not eating very well.
He's not eating very well? How long has this been going on?
Probably the last couple of weeks.
All right. Can you tell me, does he have any allergies that you're aware of?
None that we've noticed.
And other than this issue that we're seeing him for today, does he have anything else that he sees the doctor for?
No, he was fine.
Okay. And how was your pregnancy and the birth?
Pregnancy, like any other, just sick a lot, but the birth was fine. Vaginal was fine.
Okay. No complications?
No complications.
Okay. And is he your first?
He is my first. Okay. So I know, I'm scared new mom.
It's exciting, and you're probably tired.
Yeah, all the time.
And is he current on his immunizations?
So they gave him shots in the hospital, and then we saw the doctor at 2 weeks, but I don't remember them giving him anything at that point, and so we're probably due.
Okay. And then, do you have any concerns or anything that we can address while you're here with, like, financial or?
Actually, that would be really nice. My husband's been through a job change, and so, like, trying to figure out which insurance goes where and when and what's retroactive and what's not has been really confusing.
Okay, I can get somebody from social work to come and talk to you and work with you on that.
Okay, that'd be great.
All right, so a few more questions. What does he eat normally? What's his diet?
So he's breastfed.
Okay.
Solely been breastfed, and sometimes I'll come and give him a bottle. But I just don't know how much he's getting.
How long does he normally eat for?
Probably about 10 minutes on each side.
Okay. And then how often does he feed during the day?
We're still at about every couple of hours. He just seems really fussy. I'd like to move him to about 3 hours. I've been trying to get him to go about every 3 hours, but he's really fussy come 2 hours.
Okay. And then when was his last bowel movement?
Yesterday. Had a good one yesterday.
Okay. And then how many diaper changes do you typically do in a day?
It kind of varies, but somewhere around maybe 4 or 6 diapers a day.
Okay. All right. I'm going to take a look at him now. I'm just going to do a basic assessment so that we have a baseline.
Okay.
So I'll check everything. Okay? And I'll walk you through it as I'm doing it.
Okay.
Okay, so the first thing I'm going to look at is just his breathing.
Okay.
Just looking for any retractions, which I don't see any.
What's retraction?
Retraction is where it kind of goes in while they breathe. That means that they're struggling to breathe, but he doesn't look like he's struggling to breathe. He doesn't look like he's working very hard. It looks very normal.
Okay.
And what we would expect. His respiratory rate is an average rate. I'm going to do a pain scale on him. And he's relaxed and he's calm. He's not crying, so I wouldn't say that he's in any pain right now.
Yeah, he doesn't seem to be, just fussy.
And then I'm going to check his fontanelles.
Fontanelle?
That's the soft spot on the top of his head.
Okay.
At this age, it should still be open, and it is. So now I'm going to listen to him. And his lungs sound great. And his heart does as well. Let's listen to his belly. And I can hear stuff moving around in there. So that's good.
Okay.
So his skin color looks good. You can tell that he's still perfusing, which means he just has good blood flow throughout his body. Let's check this other side. I'm just gonna uncover him a little bit. Check his little feet. I'm gonna feel his pulses. Just feel his little belly. Everything feels great. I'm going to change and weigh his diaper.
Okay.
And then we'll weigh him and measure him, and then I'll get some vital signs, okay?
Okay.
All right. Covered. I'm gonna weigh him really quick. Hey, buddy. Yes, Stinky. Nope. So turning on the scale, we want to make sure it's zeroed. We'll put him down. So he's 5 pounds 4 ounces, which is 2.39 kilos.
That's not a big change since the last time we saw the doctor.
When was the last time you saw the doctor?
Like 2 weeks ago.
Okay. So now I'm going to measure him. I'm going to mark at the top of his head and at the bottom of the foot to make it a little bit easier.
What else are you measuring?
I'm measuring his chest. And then I'm going to measure his abdomen.
I'm used to them doing the head, but I haven't seen them do.
Yeah, well, especially with the feeding difficulties, we're going to want to see if his abdomen grows with him.
Okay.
And then I'll move it down. And get his little belly. Alright. Let's get him back in bed and get a diaper on him. Okay, buddy. Alright.
I want me to throw this away?
No, don't throw that away. I'm going to weigh it in just a second.
Oh, okay.
Alright, let's cover him back up. And you can hold him now.
Oh, perfect.
So you turn the scale on. And put a dry diaper on. And zero it. And then get the wet diaper. And that's our measurement. Okay. I'm going to check his temperature now.
Oh, okay.
And his blood pressure. So we'll just do his, well, let's do his temperature first. His blood pressure might upset him.
Where are you doing that?
I'm going to go in his armpit.
Oh, okay.
And it is 98.6. And now we'll get his blood pressure.
Oh,
I'm just
sorry.
going to pull, no, it's okay. I'm going to pull one of his legs out.
It's a tiny little blood pressure cuff. It's just a little tight.
So his blood pressure is 77/40, and it sounds low, but babies have lower blood pressure than adults do.
Okay.
So that's a normal
Is that
range.
where it should be?
That is just where it should be.
Okay.
So everything looks great. So I'm gonna go let the doctor know, and then as soon as I figure out the plan, then I'll come and I'll update you and let you know what we're doing.
Okay.
Okay, do you have any questions?